Cool. For this OSCE, we're going to do a lidocaine intradermal injection. So I'm just going to prep everything first. I'm going to make sure I've got my protective gear on. I've got the right-sized syringe and needle, which is 27 gauge. I've got my lidocaine. Just for this, it's a saline. I've also got a swab, alcohol swab, and a gauze bandage. So I'm just going to explain to the person why I'm going to give them this. So for whatever reason, an IV will probably cause too much pain. So we're just going to numb the site with some lidocaine and provide easy access. Just before this, do you have any allergies known for lidocaine? No? Perfect. Okay. And also it's just going to be a bit of a sharp scratch, but ultimately it's going to numb that site for IV access that we need. Do I have your consent for that? Yes? Good. Okay, I'm going to prep everything now. So I'm going to drug check my lidocaine. So it's 50 mgs and 5 mils, and it expires 2020.
Cool. So we have lidocaine 50 mgs and 5 mils, and it expires next year.
Awesome. Cool. And again, just for the purpose of this is saline. So I'm going to prep my drug now. We can administer anywhere between 0.5 or 1.5 mils. For this one, I'm just going to inject a 1 ml solution. Cool. And away. Just priming my needle. There we go. So I'm going to turn this from a blunt to a sharp. So sharps. So blunt away, and I've got my sharps all ready. So that is primed. I'm going to clean my site. So I'm looking at where I'm going to administer my needle. I see the vein that I want for my IV, so I'm going to clean around that site. And perfect. The next thing that's going to touch it is going to be my needle. I'm going to put a bit of a dash on my gloves, so once that's dry, then I know that the site is dry. And now my gloves dry, I'm going to administer the site. So this is, I'm not touching the patient, this is just to get it primed. And sharps out. Okay, it's just going to be a sharp scratch, sir. 3, 2, 1, and we go to the site. So I don't want it to be too deep. I'm going to aspirate, make sure I'm not in the blood vessel. I see a little bubble, so that's perfect. So I'm going to just going to slowly inject, so it's least painful. This was skin. I'm looking for white bleb. Unfortunately, we don't see this in the sponge. And there we go. Shuts away. Just going to wait for a minute to check for allergies. If any bleeding comes in, I've got my gore bandage ready. And once that 1 minute has subsided and there's no sort of redness or allergic reaction, then we can begin our IV. And so we'll wait a minute and we'll record what we've just done. So we'll record the site that we've done, how we've done it, so intradermal, the dosage of the drug and the drug itself, and the time which we've administered it. That is how you do a lidocaine.